Chapter 41. Diuretics. Diuretics are intended to help the body to excrete excess fluid, and this would have two main purposes. One, to decrease hypertension, and also to decrease edema. The action is produced increased urine flow by inhibiting sodium and water reabsorption. Diuretics also have that antihypertensive effect in that they're decreasing the volume within the vascular system. Diuretics have five categories: thiazide, loop, osmotic, carbonic anhydrase inhibitors, and potassium sparing. Thiazides act on the distal convoluted renal tubule and produce sodium chloride and water excretion, used for everything from hypertension to peripheral edema. Side effects would include everything from dizziness, headache, hypotension, GI distress, constipation, hyperglycemia, electrolyte imbalances, and is contraindicated in cases of renal failure, and also could interact poorly with digoxin, lithium, and other antihypertensive medications. You want to carefully assess the patient, everything from vital signs, monitoring weight, urine output, as well as careful eye on the chemistry lab values for baseline electrolytes. You also want to keep a careful eye on the peripheral extremities for any edema. Again, monitor vital signs, electrolytes, observe for any signs and symptoms of hypokalemia, monitor the patient's daily weight and urine output, and suggest that the patient take the drug early in the morning to avoid sleep disturbances. Loop diuretics. These act on the loop of Henle. It involves excretion of sodium, water, potassium, calcium, and magnesium. Common side effects are again going to be electrolyte imbalances, hyperglycemia, dizziness, headache, weakness, muscle cramping, orthostatic hypotension, hyperuricemia, hearing loss, and metabolic alkalosis. That hearing loss can be especially pronounced in cases of giving IV furosemide, IV loop diuretics, and you always want to go slow when pushing that. Assess vital signs, serum electrolytes, weight, and urine output. You also want to keep a careful eye out for any fluid overload or hypernatremia. Monitor urinary output and weight to determine the body fluids gain or loss. We want to get a very accurate daily weight on this patient. We also want to monitor vital signs, administer any IV furosemide slowly, again, because hearing loss may occur if it's given too quickly. You also want to look for any evidence of hypokalemia, as this increased output is going to flush out the potassium. Osmotic diuretics. These increase sodium reabsorption within the proximal tubule in the loop of Henle, while also helping the body to excrete sodium, chloride, potassium, and water. Its primary uses are in decreases in intracranial pressure and to promote the excretion of toxic substances. Side effects will be everything from blurred vision, fluid and electrolyte imbalances, GI distress, acidosis, pulmonary edema, and tachycardia. It's also contraindicated in cases of heart disease, heart failure, and renal failure. Carbonic anhydrase inhibitors. These block the action of the enzyme carbonic anhydrase and help the body to excrete sodium, potassium, and bicarbonate. It's used primarily to decrease intraocular pressure in patients with open angle glaucoma. Side effects would be everything from confusion, orthostatic hypotension, GI distress, metabolic acidosis, fluid and electrolyte imbalances, renal calculi, and hemolytic anemia. Potassium sparing diuretics. These block the action of aldosterone while promoting sodium and water excretion along with potassium retention. They are used in the cases of edema due to heart failure, cirrhosis of the liver, and have side effects ranging from dizziness, headache, weakness, GI distress, paresthesia, hyperkalemia, because again, unlike thiazides and loop diuretics that are flushing out the potassium, potassium sparing diuretics are excreting water while blocking the body's ability to excrete potassium. Assess vital signs, serum electrolytes, weight, and urinary output for baseline levels. Also, keep a careful eye out again, fluid overload and hyperkalemia. That's going to be a top priority. Take action. Monitor that urinary output, those eyes and nose carefully. Record any vital signs. Keep a careful eye out for any abnormal changes or trends. And again, look for any signs and symptoms of hyperkalemia. I can't stress that enough with potassium sparing diuretics. For our first practice question, a patient is taking furosemide, 40 milligrams daily for heart failure and hypertension. What is the most important for the nurse to assess the patient for the development of? That'd be A, low serum potassium, sodium, and magnesium, along with an elevated calcium. B, low serum potassium and sodium with an elevated magnesium and calcium. C, a low serum potassium, sodium, magnesium, and calcium. Or D, a low serum potassium and sodium with magnesium and calcium remaining normal. And that answer is going to be C, a low serum potassium, sodium, magnesium, and calcium. Question 2. Which statement will the nurse include when teaching a patient about loop diuretics? That be A, take the medication at bedtime. B, take the medication on an empty stomach. C, rise slowly from a lying or sitting to standing position to prevent dizziness. Or D, avoid fruits and vegetables in the diet. And that answer is C, rise slowly from a lying or sitting to standing position to prevent dizziness. Question 3. A patient is admitted to the intensive care unit with increased intracranial pressure. Which of the following does the nurse anticipate administering? That be A, furosemide, B, mannitol, C, triamterene, or D, spironolactone. And that answer is going to be B, mannitol, our osmotic diuretic. Question 4. A patient is receiving furosemide. What is most important for the nurse to monitor the patient for the development of? That be A, hyperkalemia, B, hypokalemia, C, hyponatremia, or D, hypernatremia. And that answer is going to be B, hypokalemia. Question 5. A patient with congestive heart failure gains 5 pounds in 1 week. Which of the following most indicates a fluid weight gain of 5 pounds? That be a half liter, 1 liter, 2 liters, or 3 liters? And that answer is going to be 2 liters, as a liter of water weighs 1 kilogram. Which statement about aldosterone does the nurse identify as being true? That be A, aldosterone promotes sodium excretion. B, aldosterone is a mineralocorticoid hormone. C, aldosterone promotes potassium retention. Or D, aldosterone is secreted by the pancreas. And that answer is going to be B, aldosterone is a mineralocorticoid hormone. And for our final question, a patient with chronic glaucoma is most likely to receive which drug? That be A, thiazide diuretic, B, a loop diuretic, C, a potassium sparing diuretic, or D, carbonic anhydrase inhibitors. And that answer is going to be D, carbonic anhydrase inhibitor. But anyway, that's all we got for this chapter. I'll see you in the next slides.